Hey, I'm getting the signal that we are clear for takeoff. So we will get started with this panel about returning to work. We've been in pandemic mode since March of last year, and gosh, we know that there are so many of us that have a lot of questions about what does it mean to fully return to campus. So we thank you for joining us today. Welcome. I'm Laura Jacobs. I serve as Chief of Staff. I work here in the Chancellor's office. And I'm joined here today by a distinguished panel of women who work on campus and are here to answer your questions. I'm going to introduce them and I'm going to do my best to not botch their titles, but Debbie McLoud, she's the Associate Vice Chancellor for HR. I think everybody knows Debbie. I think everybody knows everybody on this call. We also have Lisa Milam, who also works in HR. Lisa's the Director of Recruitment and Workforce Management. We've got Janelle Colbert-Diaz, and she is the Associate Director of OEOC, and she is in charge of accommodation and accessibility. We've got Trish Watkins, who is on the call. She works at the World Trade Center, but she is here today in her capacity as the Chair of Staff Senate. So thank you for joining us. And last, but certainly not least, we've got Dr. Huda Sharoff, who's the Medical Director for the Pat Walker Health Center, and she has been our steady guiding hand on the health and safety aspects for our campus community. So we welcome our panelists. We welcome all of you. Thank you for joining us. I'm going to start by saying I have 5 pages of questions in front of me, front and back, and we are going to endeavor to get through all of these. And so we'll try to group them up. We'll try to make sure that supervisors have answers for things that we aren't able to get to today. But by golly, we're gonna try. So a lot of questions have come in about why. Why are we doing this? Why now? Why is June? Middle of June, the date that we're returning back for. And so I think that's probably a good place to start our conversation. And I will just generally say that why? Because our students want us back and it's time. We're getting signals and we know that other state agencies have already begun the process, if not completely brought employees back to their respective units. And while we are a part of the state, we are considered state employees in some respects. And so we want to make sure that we are in line with what the expectations are, not only for the state of Arkansas, but by those that have been articulated by the Board of Trustees when they resolved at their last meeting that we would be face-to-face in the fall. This is the first step in making sure that we're able to accommodate those needs. So let's jump right in. You can put some questions in the chat panel, and if they are new and discrete from what we already have in front of us, we'll endeavor to answer those. But let's just start with, I think, with hybrid schedules, because there's a lot of questions about hybrid and what does that mean? And so I'm going to ask Lisa to kind of touch on that question, and let me just kind of tee it up. Can staff choose to work a hybrid schedule, half time on campus, half off, if supervisors agree?
Sure. Thanks, Laura, so much. And it's so good to be here with you all. And I'm looking so forward to just a few weeks when I'll be able to see you in person. I've been working with a group that's been diligently updating what was previously called our telecommuting policy. It's now going to be called flexible work arrangements, including remote work. So it will encompass both those flexible work schedules and also the request to work remotely. So I think there's a couple different options there. For somebody that's wanting a more permanent change to their schedule and they're seeking that flexibility on a more permanent basis, then there are considerations written into that policy that would be considered for that request. And that would be the request that the person would go through. There is supervisor department unit flexibility to provide that on a short-term basis, if that would assist with, the number of people in the office, social distancing, and that sort of thing. So there's a way to request it on a more permanent basis if that's the desire of the employee. And then there's also flexibility within the unit to provide that if that would assist with their operation and being able to operate safely.
Great, thank you. That leads us into, I think, a lot of questions grouped together about flexibility. Maybe Debbie, do you want to take just a general theme on flexibility and what that means for us?
Sure, Laura. Thanks. I appreciate that. I'm happy to be here with everyone. Flexibility It just means that, that we may have some leeway in our schedules to have some alternate work schedules that would be aligned with the policy that Lisa was talking about, that you would want to discuss with your supervisors, to get approval through the chain of command, that you could have those either on a short-term or a long-term basis. We all need to be flexible in returning to work. The guidance that we're talking about now is based on current CDC guidance, and we will be mindful of any changes that they make, and to recommend that we change our practices. The health and safety of our employees have always been our utmost concern, and this guidance has been developed to supplement that. So if there's anything more specific, I'd be happy to address, but that's our overall flexibility. Lisa, is there anything that you'd like to add on that?
No, but I did see a question in chat about when that new policy would be available, and it's just now going through the approval process. So we're hopeful that it'll be available very soon. And I'm working on the application piece of that. So those should come out at the same time, so that the policy guidance is out there, and also the way to apply if you're interested in applying for that flexible work arrangements, either remote work or a flexible schedule.
Which I think that's a great segue, Lisa, to ask Janelle to tell us a little bit about the accommodation process and how that might be different.
Thank you, Laura. So with the accommodation process, those are for individuals who have disabilities, their own medical conditions, of which their department may not, in a broad sense, have the ability to do those agreements for all of their staff. And so if you have a specific concern for yourself, then you can do a request with the Office of Equal Opportunity and Compliance. Now, I will call out, because we have received requests for individuals based on pregnancy. Pregnancy itself, just being pregnant in general, is not considered a disability under the ADA. However, if you do have some concerns, you can reach out to Human Resources and go through the FMLA process. We also have maternity and paternity policies on this campus that you can work with through your supervisorial chain. But if you have any other questions with that, then the Title IX coordinator will also be the contact for that. But for those that would have a disability that would fall under a reasonable accommodation, the pandemic situation did not change our processes. You would still do the request through OEOC. If it is not a visible disability, it's something that we still will require medical information for. We will do the assessment, work with the individual and the department through what's called the interactive process. And then we'll do an assessment based on, again, if the position is something that can be remote, staying in line with the policy that Lisa was talking about as far as the position, the worker is able to perform the duties remotely as well. And then if there's no undue hardship, then if that's something that the department will agree upon, then we'll do the approval. Now, unlike when we first went remote because of the pandemic and the urgency of it, it is not a blanket approval. It does need to go through the process. It is that interactive process. And then if there isn't a way to do a reasonable accommodation and there's an undue hardship, we still take into consideration the safety of all in the workplace. And so we'll talk about those precautionary measures that are put in place and look if there's something else that needs to be put in place as well.
Laura, I'd like to add something, if that's okay.
Of course.
Janelle has talked about the accommodations, and Lisa has talked about our flexible work arrangements and remote work policy. But I do see that there were some questions submitted about how supervisors should respond to employees who are required to return, who are just anxious and have the anxiety. They may not have the medical need for an accommodation, or they may not have a job that would be suitable for continued remote work. I would encourage the employees to know that a lot of effort has been done to ensure that our campus is safe. There are hand sanitizer stations at the entrance to every building. There's contactless soap dispensers in each of the restrooms. We will continue our mask mandate that people should wear masks that cover your nose and mouth while they're in all buildings, and even outside when social distancing can't be maintained. And at the time being, we are requiring, that people maintain that 6 feet of social distancing. So my advice to supervisors would just to really emphasize the actions that have taken to make sure that we are a safe campus. There was a lot of effort to identify how many people could safely be in like a conference room or a classroom, and those rooms have been identified. So we, I've been back for a long time. I think it's very safe, and I would encourage you to just be assured that we are taking everyone's health and safety in consideration with these plans. And there was a question about flexibility for remote work due to cold-like symptoms as a precaution. That would fall under how Lisa described those temporary arrangements that you would work out through your supervisor and your unit manager to just have to be able to work from home on a short-term basis. So we continue to be flexible in our arrangements. That's it. Thank you, Laura.
Laura, there were some follow-up questions about the accommodation process I'd like to address.
Yes, thank you.
There was a question, will applications for accommodations be provided to supervisor? The application for accommodation is for the employee, not the supervisor. We have an online accommodation request process, but we also provide our documentation in alternative formats. So there's paper formats if there's any issues with doing the online request, along with the medical statement form. If you go to oeoc.uark.edu, and we'll provide that information, all the instructions on how to do a request is there, along with the links to do the online request form. Again, that is for the employee themselves to complete, not the supervisors. And then there was another question, does that include, and I'm assuming you're asking about the eligibility for having an accommodation. It says, does that include concerns based on family medical issues that would create increased susceptibility? So again, the ADA is governed for self disabilities, not for the disabilities of others. So if there are other individuals that you may be caring for or living in your house that have concerns, that's when those things that Lisa was talking about fall under that policy, that you will work with your supervisors, or again, the FMLA working with human resources. Thank you.
Great. We have a lot of questions coming forward in the chat regarding flexible work arrangements, and looking to the fact that a lot of industries have chosen to continue remote work status, or that for various efficiencies. So could either Debbie or Lisa or both of you perhaps address that, and what does that mean for the University of Arkansas?
Yeah, I'll take a stab at it, and then Debbie, please feel free to jump in. I think the conditions we've been working under the past year are very different than what would be a normal approved remote work situation. So I think right now, in my opinion, it's important to kind of to go through those in terms of who feels that their position meets the considerations that are going to be in the policy for the university to consider, as opposed to a blanket approval, which is what we had before. I think it's also important that we're able to look at those as they come in, as opposed to just keep everyone remote, or maybe take what we've been able to do while we've been able to stay productive, and certainly all of us have, and I know we've all worked hard. I think it's important that we're able to look at it when we're not in this pandemic environment. So that's where we want to get it to this policy. And the considerations that we've kind of put in there that would be considered are, first of all, is the position appropriate for remote work? Not all of our positions lend themselves. And again, we've made that work, and we're so appreciative of that, but not all of our positions naturally lend themselves. A lot of us have the need for that face-to-face interaction. So we'll be looking at that. We want to make sure that the quality of service that we're providing to the university and to our students and to fellow staff members can be maintained. We need to look at our own performance. Do we have sustained positive performance in our roles, and can that be maintained if the person continues to work or begins to work remotely? Is the person able to work independently, and can the performance be monitored? Are there clear objectives and measurable performance objectives that can be monitored? And last, to make sure it's not going to be an undue difficulty. So we're going to need time to be able to assess those things and to look at it not just as a response to a pandemic, which we had to respond to. And so thankful we were able to pivot and do that. We need to now look at it, not so much as in a pandemic, but in the day-to-day, is this the appropriate thing, appropriate way for this work to be performed? And the new policy, and it's going to be, I had a couple questions I wanted to address while I was speaking. Someone asked if it would be available to employees. It's actually going to be in Fayetteville Policies and Procedures. It's going to replace 412.3, which is our current telecommuting policy. And then it's also going to replace a couple other smaller policies that address flexible schedules. So that will be fully available there. And that way the employee can justify those things. Those considerations that I just said can be justified based on the work the person's performed and based on the job. And then a decision can be made looking at that entirety before we approve those things. So Debbie, anything to add? That's kind of my take on it. We want to get out of this pandemic environment and move to this more normal environment.
And we need to get back to our campus culture. I mean, we are an on-campus higher ed institution, and we need to get back to that to support our students. That's not to say that remote work is not in our future, but we need to get back and just sort of re-engage with each other and, support our culture. I would want to just carry on what you said a little bit, is that it will be like an application process that an employee would do, or in conjunction with their supervisor, and the supervisor could recommend whether or not to move forward with it. But for more permanent remote work arrangements, it will be at the discretion of the dean of the unit or the vice chancellor. So we will want to maintain documentation of that, and they are, they should be reviewed periodically. It's not that, once it's approved, it's a done deal forever. We can change either for the university's best interest or the employee's best interest. So I just want to make sure that it will be a more formal process than we may have taken when we went remote for the pandemic.
Yeah, absolutely. And thank you for clarifying too, Debbie, who the approving authority is for the more permanent arrangements, being the vice chancellor or the dean of that unit would be the approving authority. And I think too, the difference is that, there's still going to be occasions we anticipate where someone needs to, go home and wait for the water, company to come and turn off water. You don't need to go through a process necessarily to make that, kind of one-off flexibility arrangement, just like you normally wouldn't. So, there's going to be some opportunity to be flexible in this. I'd like to pivot now for a second to go to Dr. Sharoff, because there are a lot of questions about vaccination. And can you just sort of tell us, Dr. Sharoff, kind of where we are and what you know about our campus vaccination status and anything else you feel germane to this discussion?
Sure. Thanks, Laura. I know that there was a question early on. Someone had talked about the immunity. As far as announcements that are made about the immunity from the vaccine, I think it was Moderna specifically stating that it lasts at least 6 months. Actually, we discussed this during an ADH meeting last week with Dr. Dillahay. She is one of the medical directors at the Arkansas Department of Health. The same question was brought up. Will a booster be necessary before the schools start back? The bottom line is that we are over 3 months from when the first COVID vaccine was administered in the United States. That was in mid-December. And there is no current evidence that the immunity is waning in any way. She actually predicts, she's making an educated prediction, that we're going to get a further announcement stating that the immunity is going to be much longer than 6 months. Again, with everything that's related to COVID and also with the COVID vaccine, we learn more and more and more with more people getting vaccinated and more data that's being collected. So she all but expects that close to the 6 month mark, they're likely going to extend that for another 6 months. So at this point, they really don't think that boosters will be necessary before schools begin in August. There was another question, I think, in the chat talking about, and this may have been more for policies. I know someone had said, well, a lot of this sounds like what we were talking about in August regarding policies. And so the question was, what's different now? Well, what's different now is that we have vaccines, thankfully. And those of us who have completed the series of COVID vaccine and are over 2 weeks out from our final doses are considered to be fully immune. And so we are protected. Vaccines are also felt to be effective against the variants that are being identified in our states and across the country. So in that regard, things are different. And they will be different because it'll be safer for those of us, the thousands of people on this campus that will be fully immunized. I'd like to have an anecdotal comment. And I'd like for all of you to take it for what it's worth. But so, our health center, the majority of my medical staff, we've been here since March. We never left because we needed to be here. We had that role here. We were essential personnel to be here on campus. What we can proudly say is due to the safety guidelines that were in place from the very beginning and that continue to be in place, masks, physically distancing, washing our hands often. And we're talking about a staff of over 50 people, and you could consider us ground zero for COVID-19 on this campus. We have not had one single case of COVID-19 infection that was actually occurred due to an exposure on the job. And we can proudly say that. I think the campus has done a great job overall. This is not just our health center, in trying to ensure the safety of everyone. I believe that the anticipation of coming back to campus is fearful. And I get that because I've had my own patients and colleagues and peers tell me this. But then once they arrive, they realize that those safety guidelines are in place and that the fear can kind of be dampened a little bit more. It's an adjustment. Don't get me wrong. It is an adjustment. But I think that you'll find that things will be okay.
Thanks.
Thank you for that, Dr. Shroff. While you're on, I'm sorry, Debbie, did you want to?
No, you go right ahead.
I was going to address a growing number of questions I think I'm seeing in the chat, but is also that had been submitted. Are we going to mandate the vaccine?
So that's also a very good question. Right now, the vaccines are under emergency use authorization only by the FDA. Obviously, that allows folks to receive the vaccine, and it's gone through the review of the FDA. But while it sits at an EUA status, the vaccine cannot be required. It can't, maybe, I'm not saying it won't be, maybe in the future like MMR has been, but again, it would need to have complete and total formal approval by the FDA for that to even happen. And that's just, that's just eliminating all the other conversations and discussions about, how can you make people do something? And I'm just saying, just getting to the bare facts, it is an emergency use authorization approval only. And with that, we cannot require that vaccine.
Great, thank you. I think questions too, since we have the medical expert here with us, would you talk to us too about continuation of testing services at Pat Walker Health Center and the availability of vaccine for students, faculty, and staff?
Sure. So testing will continue. Obviously, across this, well, we're no different than the rest of the state and the rest of the country. There has been a significant decrease in testing. We've seen that here in Pat Walker Health Center. We will still continue to offer both rapid testing for those who have symptoms that could be concerning for COVID, and continuing to offer PCR testing. That's the one that takes a day, day and a half, for those that don't have symptoms. We're also all trained on when to be suspicious for a possible variant infection. So if we have someone that presents to us with symptoms that could be COVID, and that maybe happens in the setting of being within 90 days of their initial infection, or maybe they're COVID positive after having received the vaccine 2 weeks ago or 3 weeks ago. Those are the specimens that we will collect more of, and we will send those to the Arkansas Department of Health in order to have them formally screened for variant in our state. So COVID testing at Pat Walker Health Center will not change. We will still have those resources available for campus.
That's great. This next question I'm going to tee up for Janelle to asking the question. People have been curious to know if it's a HIPAA violation to ask their colleagues if they have been vaccinated. We might want to tag team this one too, I suspect.
Yeah, so with asking about vaccinations, as it is with all of our medical information, the university has policies in place already that talks about that only appropriate individuals should be asking medical information or collecting anything on medical. So those individuals, like from my office, dealing with the reasonable accommodation process, Pat Walker for their services, FMLA, there's a business necessity for those questions and those documentations. As far as what colleagues ask each other, it really should be about the mask and the comfort level of being in an environment without a mask, especially, those meeting type sessions. We need to keep it to those. It needs to be about the actual applicability of what we're trying to address, which is, are we okay wearing a mask or not? Because we're removing those safety protocols at that stance. Now, supervisors, though, in the trying to plan for events, again, as we say with all things, they shouldn't be just broadly asking these in front of individuals. If they know that they're going to have a meeting with a group of individuals and there may be some need to have in-person meetings or some type of hybrid for those who would be in person, they can individually in a more controlled environment ask individuals, about their vaccination status, but making it very clear that the purpose of that is to ensure the safety of individuals coming to a meeting. That it shouldn't be probing into, are you going to get a vaccination? Those are those things where we start to get into medical information, which is not appropriate for individuals to be asking. It really needs to be about the necessity of what we're really trying to achieve, which is that safety of everybody in the workplace.
That leads to, go ahead.
Janelle, so it might be possible that as supervisors are planning to have staff return to work, they may be asking if they've been vaccinated.
Can a supervisor, make sure I'm understanding?
Yes.
Supervisor asking, yes. Because of that, again, that business necessity of the planning, again, that's the purpose. And again, it's not to probe. Let's be very clear about that. It's about just a very simple question. If an individual does not want to answer, that should be taken just as that. We shouldn't be pushing individuals. We shouldn't be asking any additional clarifying questions. It's just a simple and making it very clear why that question is being asked. First and foremost, supervisors should make it clear that we're looking at those return to work plans. We're looking at scheduling because, like in OEOC, we're a very small office. We all have our own individual offices. Our planning is a little easier versus other areas where there's large staff or maybe more of a community setting type where it's open desk. Those are those areas that really have to take a lot more planning. And so they really have to have those conversations with employees to make sure they're making those informed decisions. It's not about probing. It's not about getting medical information. If people feel uncomfortable answering, they have every right to say, I wish not to answer that question, but understand that then does hinder the department in making those informed decisions on how they could look at scheduling and things of that nature. So it's really about that business necessity.
Thank you. Thank you. So I think takeaway from that is where there's no mandate for vaccination for employees or for students at this time, or we don't think that's going to happen, and that it's a need to know basis, sort of limiting that. But that also we know that some of our colleagues may choose not to get vaccinated, and that's something too that we need to be, I think, mindful and sensitive of, so that we don't inadvertently make people feel excluded or, not part of the team for making that decision. Of course, we do recommend and we do advocate for the vaccine just as an educational institution, but we're stopping short of the requirement language. Let's see, I'm trying to decide where to go next. We've got so many questions, but let's return to that idea about the sort of shared group spaces where there's maybe an office that's more of a sort of an open room, sort of a newsroom, I would have called it in a former life. Debbie, can you talk to us about what provisions have been made or will be made to address the distance?
The one that keeps coming up frequently is the one in University IT Services, the open workspace. And we have facilitated contact with the Environmental Health and Safety Group at Facilities Management with the management of UITS to assess the work area and the air quality in the work area. And they will be providing recommendations to the management of UITS on, how things might be how the workspace may be used to make sure that we're being we're mindful of the 6 feet of social distancing. Mask will still continue to be a requirement, and of course, frequent hand washing. So there are steps to be taken that would apply to any workspace where they're not sure that 6 feet of distance can be maintained. It could be that the management decides that would be an appropriate time to continue some flexible work arrangements, whether it's hybrid, where part of the staff works for a few days and then works remotely the rest of the time, and then they alternate to make sure that we can maintain that 6 feet of social distancing to keep everyone safe as possible. Is there anything else that you can think of to add? Let me just look at my notes.
Debbie, can you address the issue about people who may not have a permanent office and have access to what we call hoteling space?
Well, I think we always need to be mindful of the 6 feet of social distancing and mask when they come. I'm assuming if they have hoteling space, they're probably not scheduled to be here every day, all day. So when they're scheduled to be on campus and have hoteling space, they still need to follow whatever guidelines we have in place at the time, which today is, wearing your face covering and doing 6 feet social distancing and frequent hand sanitizing. And, for the workspace, we have, for the time being, devoted our cleaning staff to really disinfecting and cleaning the more frequent high traffic areas. So we have all been assigned bags with face masks and hand sanitizers and disinfectant spray and thermometers and cleaning supplies. So for the time being, we are keeping our own work areas clean and involving even taking our trash out to central receptacle. So, and that's going to continue for at least a little while until we get different guidance from the CDC. So I just happened to think about that, Laura. Sorry, it may not go along too much, but
no, that's perfect. I suspect we'll need to come back and answer similar questions in different ways. Can you tell us what hoteling space means for some people who might not be familiar with the term?
Well, hoteling space it's not a space that's been dedicated to you 100%. You may share it with other people, not all at the same time, of course. But say, I come in Monday, Wednesday, Friday, and I use a workspace, but Lisa comes in on Tuesday and Thursday and use the same workspace. Probably you are equipped with a laptop or something like that you take with you, with the expectation that you probably work remotely the rest of the time.
Great, super. Well, I'd like to move to Trish Watkins now because we haven't heard from Trish, and I know that in her role as Chair of Staff Senate, she hears from a lot of employees with concerns about child care and other matters. So Trish, can you talk to us a little bit about, what should people be thinking about with regard to child care, et cetera?
Sure. First of all, I want to give a thank you to the administration for the decision that you made to delay the staff returning to campus until after public schools are finished. We understand that there are a lot of you that your children are home with you every day or are on some sort of virtual learning days. And it would be hard for you to take them somewhere else because they need the supervision for the learning process. And again, thank you so much to the administration for not only allowing the staff to stay home with those children until school's out, but this is giving you adequate time to find some sort of childcare or something for your children this summer. I do know I've had some talk to me about summer camps. I do know the city of Fayetteville is organizing some summer camps, and others are as well. I do believe that they are safe, and that you could probably reach out to the city of Fayetteville and what it is that they've got planned. While I've got the floor here real quick, something else I want to give a big, huge shout out to, and a thank you that there have been absolutely no furloughs since we've started this process. The flexibility and the understanding of work-life balance is very much appreciated.
Great, thank you. We appreciate that. Just to sort of summarize a number of questions in the chat about some of these guidelines as it relates to physical office space and shared break rooms and conference rooms, things where people are used to stashing their lunch. Can someone talk to us a little bit about what we can expect in that regard?
Well, I'd be happy to address it, and then Huda can jump in if she needs to. As far as for shared break rooms and kitchen spaces, potlucks are not recommended at this time. Any food that is stored in a refrigerator should be in a closed container. We recommend that employees use disposable cups, plates, utensils, if possible. If they use, regular dishware, that they should bring their own and wash it immediately after use. There should be some cleaning supplies in the break room and in the conference room to clean up, wipe down surfaces after it's been used. As far as water fountains, for the time being, the water fountain part will be shut off, continue to be shut off, but the bottle filler stations will continue to be in operation. Is there anything else you can think of, Huda?
No, Debbie, that covered it. That was good.
Great. I just think it means, we need to just be mindful to kind of wipe down surfaces after we've used them in these shared spaces.
I'm glad you mentioned the kit. So all employees were provided with a kit at the start of last fall semester. And in that kit, there were wipes and some spray and some hand sanitizer and some face coverings. Are we able to replenish those items as we need them?
Yes, the central supply desk and facilities management is the place to contact if you need them. If you haven't been on campus for a while, you may have one sitting on your desk or workspace area. They made a huge effort to deliver those bags in the beginning of the fall semester, but they are available by contacting Central Supply.
And so speaking of, if I haven't been to campus in a long time, I may not have purchased a parking permit.
Okay. Well, I know that Gary Smith is on the call. I did speak with him right before we met and got the summary of how it's going to work. Of course, you will be required to have a permit when you return to campus. However, you will be prorated for the amount of time that you need between now and July 31st. If you return to campus in May, you pay for May. If you return in June, you pay for June. And you pay a full month no matter what day of the month that you start, but you will only be prorated for the amount of time that you use. And then we start with the new license plate recognition system on August 1st when we'll renew our permits. At this time, online purchasing is not available due to the transition to the license plate recognition software, but you can purchase it at the parking and transit office in the administrative services building. And Gary assures me that there's free parking available at that building if you want to go in and get your permit. We will work with you to do in human resources to do payroll deductions if that's what you need for the remainder of this permit year. We're happy to do that as service to help with your transition back to campus. And I do see Gary down there. And if there's something that I've overlooked, Gary, do you want to jump in and talk about that?
Debbie, I think you covered it well. Thank you.
Oh, you're welcome. Thanks for being on. There will not be any refunds. Sorry, I did ask Gary if there would be any refunds, but no refunds, but just know that you're going to only have to pay for what you need this year if you didn't renew for this fiscal year.
Will there be, Gary or Debbie, a day rate? You may have said this and I missed it. A day rate for those employees who are only coming, who will continue to come on an intermittent basis to access hoteling space?
Gary did mention that they're working on that now. So it is in the process and something that's being discussed. So they're trying to work out the details for that. I'm not sure it'll be ready in June though. So.
Okay, we will be on the lookout for that. We will be on the lookout. I'm watching the chat and I think we've covered a lot of the questions, but I know there are still many, many more. I would ask my esteemed panel if there's an additional topic they'd like to address while they're watching the chat too.
I have one. There were some comments in here about the concern about discrimination against people who are not vaccinated. The point is not to ask about the colleagues specifically. It's not about asking about their vaccination status. It's about asking about if they're comfortable not wearing masks in those enclosed spaces, or those spaces that Debbie and Huda have talked about, of which we want to make sure we're taking those safety precautions. If an individual is not comfortable not wearing a mask, then they can simply say that. For example, I'll disclose my own self. I have been vaccinated, but I still want to wear my mask in those type of environments. And so if I was asked, even though I have been vaccinated, I would say I'm uncomfortable being without a mask in those public areas. So that's not about asking about my vaccination status nor discriminating against me. That's about asking about my comfort level with wearing that mask. That would not be a discrimination situation. Again, we're making sure to say to people that it's not about the probing. It's not about the asking well, why won't you or why don't you or any of that kind of those type of questions. It's simply about asking about comfort level. You get a yes or no, and then that should end the conversation. If you do feel like somebody is probing, or if you feel like there are some inappropriate questions that are being asked, please contact our office so that we can be aware of what is going on and we can we can address it appropriately.
Great, thank you. Thank you very much for that. Another question came up about the water fountains. We have placed signage on all the water fountains that discontinue the button part that you push and then you drink from the spout, but that there do we know if there are bottled water filling stations in all of our campus buildings, or is that something that needs to be requested?
I think that needs to be requested, Laura. I'm not sure they're in all the buildings.
Okay, well, that's something that we'll look into. So I would encourage people to ask their building executive in that case if that's something that's missing from their building. And then also about parking for students and graduate students. Are there any type of, is the same pro rate strategy available to them, Debbie or Gary?
You were kind of cutting out, Laura.
I'm sorry.
Sure.
I'm sorry. I'm asking a question about the prorated parking strategies for students.
Well, I'm going to guess that it's probably the proration is available to everyone who needs one for this summer. And Gary, you can jump off if I'm incorrect. But
No, Debbie, you are correct. Any permit purchased throughout the year will be prorated until the end of the expiration date on the permit.
thank you, Gary.
Laura, I've got a couple of answers for some of the questions in the chat.
Thank you. Perfect. Jump in.
No worries. Okay, there was a question earlier on. Someone was asking about, is there antibody testing available at the clinic to see if our vaccine was effective? So I'm so glad that they asked this question. So let's go back to, there was a lot of talk about these blood tests for COVID early on in the pandemic. So some false claims about come get your blood tested, see if you've already had COVID, see if you have immunity against COVID. And that's not what the blood test does. The blood test can detect antibodies, but they're not necessarily specific to COVID-19. So unfortunately, folks that had those tests done were given a false sense of security. So the same can be said now. If you've been vaccinated, there's not really a blood test that you can go in and ask and see if the vaccine has been effective. The trials for the vaccines monitored symptoms after vaccination. Found that people did not develop any symptoms concerning for COVID. And right now, they're thinking that there may not even be a carrier state for COVID if you've been vaccinated. So the short answer is no. If someone is offering it to you, please don't do that because I don't want you to waste money on a test that may give you false answers. And so until we hear more or something else is offered, I would definitely not go that route. The other question I think in the chat box was, how do I know if it's COVID versus allergies versus a cold? Again, the short answer is you really don't know. As we've learned from COVID-19, people can have mild, if minimal symptoms, and then others unfortunately have to be seen in an emergency room setting. So, our Garland Garage Respiratory Clinic, I would just urge you, if you have a stuffy nose, if you have a sore throat, if you have a low-grade fever or a cough, just get evaluated. Thankfully, we have rapid COVID testing. So in our clinic, I know we'll do a rapid COVID test on a patient, and if it's negative, we may do further testing. We may do a flu swab. We may do a strep screen. We may just say, nah, it's just allergies. We'll treat you for allergies. So I'm not expecting patients to make that distinction because it really can't be done. So I would just urge you to go ahead and be on the safe side of things, get that rapid COVID test and just get evaluated. And if it's just allergies, that's just great. Your medical provider will tell you what you can take. The other question that came up in another meeting this week was, I just want to make sure that everybody is clear that the vaccination will not give you a positive COVID test. I've had some folks say, well, maybe, I feel so great. Maybe my test's positive because I was vaccinated 2 or 3 weeks ago. I'm like, no, that's not the way that this works. The COVID tests detect the virus, the active virus, and none of these vaccines have active live virus. Hence, none of them will give you a COVID-19 infection. So I also just wanted to make that really clear. One more question was about masks. How's that going to look for the fall semester? Wow. Okay. So that's 4 months away. So we'll see what happens between now and August. Right now, the mask mandate on campus is in place. It depends on how many people get vaccinated. Are we close to herd immunity in our area? What's the incidence of active disease? But for now, it will continue.
That's great. So yes, just to reiterate, masking will continue. Who feel comfortable disclosing their vaccination status may choose to remove a mask in a small group meeting and in their own personal office. So I think there's a lot of interest in that. Excellent.
Hey, Laura.
Yes, ma'am.
I saw a question I wanted to address about enforcement. And I think the question was more with students, but I do think it's important that we're all, as we see maybe folks that aren't doing the things that need to be done to keep us all safe, that we are comfortable reporting those either through our chain of command. You can reach out to human resources and we'll try to make sure that there's some additional information, but we do want you to know that we will help with enforcement of the requirements that keep all of us safe.
Great, thank you. There was a question too about, we're talking about non-faculty employees with this return, but there are faculty who do work on 12-month appointments and are on campus too. So maybe can we address what that means for the faculty who may be 12-month appointment, Debbie?
Well, the requirement to be back by June 14th is for non-faculty staff, but there's nothing that says people can't come back to work. The campus is open and anyone can come back to work. They don't have to wait till June 14th. They're welcome to come back now. I would make sure you have a conversation with your supervisor just so that everyone's aware, but the campus has never been really closed, but so we're welcoming everyone back. Faculty, the guidelines for right now just apply to non-faculty staff, but if the faculty are coming back to work, they are expected to adhere to the same requirements of the masking and the social distancing and things like that.
And it's probably worth mentioning that we are going to host another session that is focusing on the faculty return and how that really addresses the classrooms. And that will be later this month. I don't have the date in front of me, but we are planning for summer school. And I think summer school will largely be remote or hybrid. There may be some face-to-face classes just as there are now. And then really the aim is to be back fully in face-to-face courses that aren't already, distance education courses for the fall. So I see a lot of questions still coming in about masking, and we may have made it more confusing by providing some caveats. So do we want to address some of those questions about, I want to make sure that nobody feels confused about the expectations or how they can, function in their office space with a mask.
Sure. I'd appreciate who to support, but if you're in your own private workspace, especially, if there's a door, even without, and you can maintain that more than 6 feet distance, you can work without a mask. Is that correct, Huda?
It is. And you know what? I echo exactly what Janelle said. We have our, medical provider meetings. And so a couple of weeks ago, we decided that we'd all meet in our admin conference room together and see each other in real life, which was huge. But I can tell you that while all of us were fully vaccinated, I would say the majority of everyone kept their masks on. I mean, there's just mask fear. I mean, there's just nervousness about getting rid of your masks. I mean, I'm trying to gradually move our group in that direction. And so I'm like, well, maybe if I bring donuts and people have to eat, they will take their mask off. Or, we're trying to make a little joke out of it, but the fear is there. I mean, most of us wear it. I don't even realize I have it on anymore. It's just part of what I do every day. So just because someone's wearing the mask does not necessarily mean that they have not been vaccinated. I mean, that is definitely not the case. And so I just wanted to make that very clear as well. And I'm so glad that Janelle made that comment, because that's perfect. I mean, that was perfect. If you're fully vaccinated and you develop symptoms, do I need to get tested? Sure. Because again, it's likely not COVID. I mean, it's maybe something else. And if it is on the rare chance that it is COVID, well, we probably need to screen that person for the variant. That information is really helpful. I mean, all of the vaccines are pretty much 100% effective in not causing, in basic, how do I phrase this? They're 100% effective in preventing severe symptoms and hospitalization from COVID-19. So, nothing in life is 100% except for death and taxes. So, but even if you were to develop, let's say, COVID, you would most likely just have some minimal or mild symptoms. But again, we can't be tunnel visioned. There are other things out there that cause infections. And so you need to be evaluated and treated by your provider. None of the vaccines currently on the market are live vaccines. It's not like an MMR. With an MMR, those that have weak immune systems, whether from underlying medical conditions or from medications, they can't get it because MMR is a live vaccine and can cause infection. None of the COVID-19 vaccines on the market are live. If you have a weakened immune system or taking medicine that weakens your immune system, you can still get the vaccine. You may not have as robust of an immune response to the vaccine as someone who does not have those issues, but there's no contraindication for you to receive the vaccination. And I think that's it.
Okay, thank you. Thank you. So 6 feet of social distancing. We're wearing masks in public spaces. We're wearing masks in our own offices if we feel most comfortable doing so. We can ask people to wear a mask when they come into our private offices. If we feel comfortable removing our mask in a meeting because we're fully vaccinated, we may do so. Nodding heads, yes. Okay. Excellent. You mentioned no potlucks, and then we talked about shared storage for food. Can we talk a little bit about what catering options, what that looks like to our campus and how we might be able to accommodate food service?
The recommendation would be to have catering provided in individual containers to facilitate contactless serving. So, no buffets or anything like that are recommended at this time.
So
individual containers.
Packages of granola bars or
right.
Cups with lids or
yes.
Packaged pastries in individual little baggies.
If possible, yes.
Okay, excellent. Excellent. Dr. Sharaf, would you like to add? Do you have another statement about vaccines?
I do, because I've been seeing some of the comments in the chats. And so I just wanted to make sure that, everybody's on the same page. Obviously yesterday morning, most people read the news, heard the news, watched the news in regards to Johnson & Johnson vaccine, otherwise known as Janssen or Janssen, and some data that's come out that they have identified. They're still trying to determine whether there actually is a link between these 6 women and Johnson & Johnson vaccine. But there were 6 women identified between the ages of 18 and 48 that all developed symptoms 6 to 13 days out from their Johnson & Johnson dose. These 6 individuals were found to have a blood clot and abnormal platelets, which are the cells that clot your blood. So right now, there has not been a direct link. The immunization committee is actually meeting now actually to discuss this data, and they'll be discussing that for the next 3 hours and trying to figure out if there's any type of direct correlation or perhaps there's another common thread between these 6 individuals. Please note that up to this point, we've had almost 7 million doses of Johnson & Johnson vaccine administered in the United States. These were 6 out of 7 million doses. I'm not minimizing the fact that these 6 individuals had have a significant diagnosis, but I just want to make sure that we're putting this all in perspective. I also would like to say that COVID-19 infection on its own, this is outside of the vaccine, COVID-19 infection on its own has proven to have some significant long-term medical complications. One of them also being blood clots. But not only that, can cause long-term complications with your lungs from scarring and breathing difficulties, can cause heart problems, can also cause cognitive or brain inflammation and injury, again, as well as the clots. So, we've been living in this pandemic now for over a year. So unfortunately, with the number of people that have been affected and the number of deaths that the country has had, there's been a surplus of data regarding all of the complications and long-term symptoms that can be had from COVID-19. So I just want folks to just keep that in perspective, we still need people to be vaccinated. Moderna and Pfizer have both administered over 180 million doses of COVID-19 vaccine in the United States. And there's been no correlation with clot disorders. Now, as I said, people can have a complication from a flu shot. I mean, it's rare, but it can happen. I mean, the bottom line is people could develop an allergic reaction from it, but the benefits of these vaccines far outweighs any potential risk at this point. And so, I'm here just like I said, I'm not preaching to anyone. Everyone has the right and the freedom to make their own decisions. But I just want to make sure that the right information is out there. And when you are looking for that data, please be sure to check with reputable science evidence and science-backed groups. The rumor mill, as we all know, can get a little bit out of hand with misinformation. And so just at least make an informed decision. That's all I would ask.
Thank you for that excellent response. That's helpful information. We are at the end of our time here today, and I know we've probably just barely scratched the surface in terms of everything we could possibly talk about, but we just really want to leave everyone here with the message that it's safe to come back, and we can't wait to see you. A lot of us have been here on campus since August, since September, and we look forward to having even more of our colleagues return to campus. We are going to equip supervisors with some checklists and some tools to help them with their planning, and I know that they want to hear from you with regard to what your ideas are for returning to campus and helping to ensure that you've got a safe space. Campus is safe. We're happy to have you back. The faculty session I referred to earlier is scheduled for April 27th, so there will be some more information coming forth about that. And I think that's the conclusion of today's program. We really thank you for spending your lunch hour with us, and we look forward to you soon. Thank you.